everyone. It is Kevin Henry, the co-founder of Ignite DA. Hope you all are doing well, and joined today by my co-founder of Ignite DA, as well as the founder of Ignite DDS, and just all around good dude. That's Dr. David Rice. Dave, what's up, man?
Hey, Kev, how are you?
I'm good. I'm good. Ready to chat a little bit about some important things in the dental practice today.
Me too. You know, we have been talking a lot about top of mind patient isms, and I think we can officially say top of mind team isms now. There's obviously a lot of chatter out there about am I safe from both patient and team standpoint. So yeah, let's get into the weeds. We've talked about a lot of things from PPE. We've talked about some different infection control things, but let's start talking about maybe individual topics.
Yeah, let's do it. And you know, one that jumps to mind for me is the value of cassettes whenever it comes to instruments, whenever it comes to presenting that not only from the patient's point of view, but also making sure that the team feels a little bit more organized and things like that. What are some of the things that you're seeing with that out there whenever you talk to some fellow dentists about it?
Yeah, I'll tell you. So I've had cassettes in my world since I was a dental student. So, you know, UB Dental School, I'm sure all the hygiene schools, all the dental schools, at some point you all started with cassettes. The question is, do you have them now in your practice? And if you don't, you know, why did the teaching institutions have them? And maybe you don't. And I love your point. I think, you know, if top of mind in everybody's world right now is safety, then from a team standpoint, cassettes make sterilization, that process from cleaning to you know, in and out of oven, about as safe as it can be, right? We have to obviously touch instruments, but aside from that, it's packaged well, we can sterilize well, and then our teams are safer. And I'm guessing if you're a teammate watching this, that makes you smile.
And you know, and that's one of the things I've heard from so many team members is obviously it reduces the opportunities for pokes or, you know, any problems when it comes to the instruments. And, you know, I will tell you that one assistant was telling me earlier this week about how that they have incorporated the cassettes as part of their marketing strategy at their practice. And, you know, doing the whole unveiling of the instruments and everything right there in front of the patient, you know, and they did it specifically for a patient that they knew was maybe a little bit nervous about being in there, about coming back after COVID. And she said that it was really something that they walked that person through everything they're doing to keep them safe. You know, of course, in the hazmat suit now that so many practices have on, but still, it was something that they really saw as an opportunity to present something and almost make it an ooh-ah moment, you know, but they said it made an impact on that patient.
You know, you're right. And I'll tell you, so we've always unpackaged our instruments in front of our patients for 26 years. It's just habit. But you know, now more than ever, patients want to feel safe. So making a point of it, like that assistant shared with you, is really, really a smart move to make from the feel good and the do good standpoint. Realistically, right? There's no reason for us to unpackage instruments 20 minutes, 10 minutes, 15 minutes before somebody comes in.
Right.
Except if you don't have cassettes, you're probably opening up those wonderful little pouches and you're trying to lay all your instruments out so you can get organized, which to me is another big benefit of a cassette. Is it's instant organization. Every single person on the team knows, whether you're on the hygiene side or the restorative side, what setups look like. It's reproducible, it's predictable, it's efficient. And in addition to marketing, it's really effective because now we can unpackage right in front of that patient live and everything's ready to go.
Yeah. And I think that that's important. I mean, obviously, you know, we're talking about the team's mentality, you know, but it does just kind of lower that level of, you know, if everything's already laid out for you, if everything's already done, that's one less box you have to check. And we know how many boxes there are to check now with, you know, making sure everything is safe for the patients and the team every day, every appointment. And so that's just one less thing that you've got to worry about, is pulling that out, making sure it's there. And again, if you work that into the presentation, hey, great, so be it.
I love that. Yeah. And, you know, and then, you know, this, like, who would have thought you could talk about cassettes for a while, but you really can, because, you know, so safety leads to organization, organization leads to productivity. So I will tell you, as a dentist, One of my pet peeves from a former life is not having instruments that we need. So every time in your practice, and I know not all of you are watching practice, but somebody's told you the story but that you have to stop, get up, and go get an instrument because you don't have it ready, you are losing productivity. In today's world, add to that exactly what we're talking about, the safety factor. You're putting yourself at risk, you're putting team members at risk, you're putting your patient at risk. And if you're not paying attention, other team members are. And if you and your team aren't paying attention, your patients are. So think about the simplicity of this one part of your armamentarium that totally changes how you practice in a good way.
Yeah, and I think if you have to get up to go get that instrument, it's just almost that, it just rises just a little bit, maybe frustration, anxiety, whatever it might be, but it's enough that everybody in the room can pick up on it. And right now, we need to be doing everything we can to lower that rather than raise it. And it's a small thing, but like you said, when minutes matter and productivity is so important right now, maybe more than ever, to have that happen is, it can be a problem. Let's be honest.
Yeah, and I think if you look in dentistry at bigger practices, whether you love the model or don't love the model, what they do very, very well is they have very efficient and effective systems. And if you look at any business in the history of humanity that's gone from like this teeny little business and like risen super fast, like crazy high trajectory, they have great, look at Amazon. Amidst all this insanity, you and I can still order from Amazon, and most things that are backstock still get there the next day or 2 days later because they have great systems. So cassettes, in my humble opinion, are a great opportunity, guys, to like refine your system and perform at a higher level without really putting a lot of thought and energy into the process. And I think there's probably some pretty good deals to be had out there now. So from a business standpoint, I'm always looking for opportunities, right? Every obstacle brings them. This is an opportunity.
I I love, you say business, my ears perk up. I mean, I love that because you and I hammer home so often. You got to know your numbers. You got to, all the things on the practice management side, but the system side is so important. And sometimes people, let's be honest, they slough off on that part of it. Yet that could be the most critical part between, like you said, that business taking off. And Amazon is such a great example of that, and even with some things that maybe have taken a day or two longer than expected, how about that communication that has gone out to say, hey, just so and again, I think it's important that you are conveying whatever is going on to your patients. You're explaining to them how you're keeping them safe and how you're showing them how you're acting. It all goes into that mentality of, I made a good decision by coming in to have my teeth cleaned or to have this crown checked today.
Totally agree with you. I totally agree with you. So, I know all of you out there in practice, sometimes we tend to look for these big, gigantic home runs that are going to totally change the way the world works. And home runs are wonderful. But as a baseball guy, Kev, you're a baseball guy, a team that hits singles and doubles all day, every day, those are the teams that win World Series.
And I'm telling you, I'll take Ichiro on my team any day, slapping singles. I absolutely will.
Totally. Yeah. So for those of you out in practice, pay attention. It's the little things and constantly doing all the little things at a high level, at the highest level you can possibly do them. So we talked about we talked about safety, we talked about organization, we talked about how that leads to efficiency, effectiveness, and ultimately at the end of the day, being productive with our time. So Kev, any final thoughts?
No, I have, like you said, we talked about cassettes for quite a while here. It kind of went around the gamut, but again, I think it's important. It's these little things that make a difference right now, maybe more than ever, and making sure that you're doing the little things well. So hey, great points, and let's talk about some more infection control stuff sometime soon.
I like that. All right, gang. So listen, get your systems in order, get your processes, your protocols in order. Remember, it's that additive effect, lots of little things. Kev, always great hanging out with you. I'm sure we'll do this again, and maybe we just pick out another piece of this puzzle and help practices plug in some things at work.
Let's do it.
All right. Cheers, guys.